So this is part 2 of our lecture on the diseases of the integumentary system. We're going to start by talking about pyoderma. Pyoderma, all this means is that it is a bacterial infection involving the skin. So pyo generally means pus in the dermis or pus in the skin. Pyodermas can be primary or secondary, superficial or deep, and we're going to use those terms in order to describe where the bacterial infection is. The disease is recognized as a part of several distinct clinical syndromes. So a lot of different things can happen, and they can cause a pyoderma. Superficial pyoderma is clinically seen. Diseases in this superficial pyoderma category include acute moist dermatitis. That's the fancy term for hot spot. We also will talk about impetigo, acne, and skin fold pyodermas in this superficial pyoderma. A superficial pyoderma just means it's on the top portion of the skin, the superficial epidermis. Healing occurring without scarring, so it's not deep enough that it creates such a major effect that it creates a scar on the top of the skin. It's usually a short duration, and the animal is rarely systemically ill. The skin around the lesion remains normal, whereas the affected portions may be ulcerated or traumatized by the animal. So, hotspots. No big mystery with acute moist dermatitis or hotspots. Usually it's secondary to skin trauma, and it's usually self-inflicted. The mystery occurs in trying to decipher what caused them to scratch themselves in the first place. Usually what you'll see is a well demarcated, meaning it's well outlined, red, moist, hot, and painful area. The condition is common in heavy-coated water-loving breeds like Golden Retrievers, Labrador Retrievers, Newfoundlands, German Shepherds, and St. Bernards. The incidence of the disease appears to be seasonal, being worse in the hot, moist summer months. Those of you who already work in a clinic have probably already seen this. Rapid appearance of red, hot, moist, painful patches, hair loss over the area, pruritus or itching. That's usually what caused the problem in the first place. And a visual inspection of the affected area shows these typical lesions. Now, I know all of you have been in the clinic this summer, and if you did not see one hot spot, I'd like to hear about that because that's very unusual. So the treatment, you know the treatment, right? You carefully clip the hair around the lesions. You're going to clip it large enough so that you're seeing the edges of the lesion, you're seeing normal skin. If these are really large or very painful lesions, you may want to sedate the pet. We're going to gently clean the skin using a medicated shampoo like Etiderm, Alloderm, or Chlorhexaderm. We're going to topically apply medications to the lesions twice a day. We're going to want to avoid medications that dry or attract attention to the site because that'll increase self-trauma, licking or rubbing. We don't always use a topical medication. Whenever we're trying to get something to heal, anytime we put something topically on it, with the exception of a few items, will cause the healing to be delayed. But if we have active infection, then using something like gentamicin spray can be very helpful. So we're going to treat the original disease also that caused the self-trauma. So if there's fleas or an allergy or an ear infection, we want to treat that. Occasionally, we get increase in healing if we can keep them from doing further damage. So a steroid, even though steroids usually decrease or delay healing, in this case, if we keep them from itching, it will actually speed healing up. And then systemic antibiotics if it's spread across a lot of the skin. Prednisone, usually we just use it daily, a small dose daily for a week. Cephalexin, typically used twice a day. Enrofloxacin, also known as Baytril, we use twice a day. Clavamox we might use twice a day. The thing I want you to remember when I talk about drugs in this particular course is, in general, understand antibiotics, cephalexin, enrofloxacin, amoxicillin, clavulanic acid is Clavamox, or prednisone. In general, understand it's antibiotics or steroids. The main thing to tell your client is keep it clean, keep it dry, and don't let them lick it or don't let them scratch at it. So your client is going to need to go home and clean it daily as well. That's going to help speed the recovery, keep the bacterial load down. We want the owners to prevent to wash their hands after they treat an infected animal. There are times when Staphylococcus have been transferred from a pet to an immunosuppressed owner. We don't want to have any problems with specifically Staphylococcus that could be methicillin resistant. And human infections are rare. So again, we're just causing danger to the owners who are immunosuppressed, but just be cautious about that. We want the lesions, we're watching the lesions. Sometimes it takes a long time to heal, depending on how big they are. If the animal is going to harm themselves again, they need to wear an Elizabethan collar. Sometimes it's harder to get the owners to comply than it is to get the animal to comply with that. Impetigo. Impetigo is most commonly seen in young dogs as a secondary infection related to malnourishment, debilitation, or poor hygiene. This is something we actually see in kids that are maybe mildly neglected or majorly neglected as well. Streptococcus is the usual organism involved, although staphylococci are occasionally cultured from lesions. The disease is not contagious, it's just a disease of the animal themselves. Mostly we see these lesions in young dogs. Lesions are commonly seen on the abdomen, and they'll include pustules that rupture to form honey-colored crusts. And those honey-colored crusts, when we see that, we think impetigo. Really what it is a pustule that is ruptured, and the pus that was within the pustule is now dried up and flaking on the skin. Mostly these lesions are non-pruritic, they're non-painful. We diagnose it by seeing it in a young animal, and we can do a culture and sensitivity. Treatment, improve the animal's general health. Systemic antibiotics may be needed if we want to base it on culture and sensitivity, or just an antibiotic with a good gram-positive spectrum. Gram-positive bacteria usually are the ones that are living on or just within the skin. Cephalexin can be given twice a day, and rofloxacin or Baytril can be used twice a day, but we have to remember that we never give Baytril to an animal that's younger than 6 months, because what it does is it closes the growth plates and it will stunt their growth. So try to put that in your head somewhere, because we're going to hit that again. Clavamox, we can do that twice a day. We can clean the lesions using antibacterial shampoo like chlorhexaderm or Etiderm, Allerderm. Use at 2 to 3 day intervals after the initial cleaning. We can use a topical antibiotic cream, apply it to the lesions. Tell the client that it is not contagious. Impetigo is not contagious. Programs for elimination of parasites, improve the diet, better sanitation should be implemented, and it will help to improve the general health of the animal. We're going to continue the treatment for at least 2 weeks after the lesions disappear. So I want to make sure that they are on board with that. Often those lesions will disappear within or get better within a few days. So it's not hard to maintain that for a couple of weeks. Acne. Canine acne is fairly common in young, 3 to 12 months of age, short-coated breeds. The disease prevents very few problems clinically. As dogs mature, the lesions will spontaneously heal. But feline acne is clinically significant and often becomes a chronic problem. And acne will occur in cats of all ages. So in this picture up here, this is a picture of a muzzle of a dog. You can see pretty big pustules. This is acne in the dog. A lot of times we can relate this reaction to a poor immune system, so that's younger dogs. But also sometimes we see it in animals that are allergic to either the food that they're eating or the plastic in the plastic food bowl. Plastic over time degrades and breaks down into small particles, and animals can be allergic to those small particles. With cats, it is often a chronic issue. So it might look like this on the chin of a cat, chin acne, and when we start to clean it up, you notice that very quickly it becomes bloody and scabby because the lesion is actually underneath the hair. We also call these lesions little blackheads, miliary dermatitis or folliculitis. It's often related with cats to allergies, food allergies, or an allergy within the environment. And they are rubbing their damaged skin on surfaces to mark territory, and then they get these blackheads. Treatment is to gently clip the hair on the chin and then use an antibacterial soap. Sometimes we need to pop those blackheads, and sometimes we need sedation. We've had really good luck using a human acne product like Stridex pads that have benzoyl peroxide in it, but you do need to use it daily. If it's really bad, we can use systemic antibiotics for 2 to 3 weeks. It's the same choices for as you would choose for Impetigo. Basically things that have good gram-positive spectrum. They're going to kill gram-positive bacteria. What you will see is the chin may be swollen and painful to the touch, and the owners may report seeing dark spots on the chin and may be concerned about cancer, neoplasia. Comedones or blackheads is what you're going to see. Cats that are severely affected may actually be febrile or have a fever. The characteristic appearance is basically diagnostic. We may have to rule out other skin infections such as bite abscesses if we have a particularly swollen area of the chin. Skin fold pyoderma. Skin fold pyoderma occurs when skin is plentiful. So think about those breeds that have lots of folds of their skin. So shortened breeds, squatter breeds, breeds like bulldogs, breeds like pugs, breeds like Boston Terriers, breeds like bloodhounds or basset hounds. So anytime you have a lot of plentiful skin that's folded over on itself, the redundant tissue in the fold traps moisture and heat, and whereas constant rubbing results in trauma and secondary infection. So remember that folded skin has hair on both sides, so it's constantly rubbing on each other. Sometimes we have facial folds that present a danger to the cornea of the eye if the facial fold folds the hair into and onto the surface of the cornea. Skin fold pyodermas are a chronic treatment that requires long-term medical treatment. Sometimes we can do surgical removal of excess skin in order to effect a cure. Diagnosis, obviously, is going to be commonly affected breeds, spaniels, setters with lip folds, big droopy lips, Pekingese and pugs with facial folds, Boston Terriers and pugs with tail folds, and a beast dog of any breed with tail and vulvar folds. Sometimes we'll get a foul odor or discharge from that area, and that can be diagnostic, or the affected area when you pull the skin apart will be moist, red, and ulcerated. We need to clip and clean that area. Be careful though clipping it. If you make the hair shorter, sometimes that increases the irritation. We need to dry those lesions. Once we've cleaned the area, we pat it dry, and then we can put a topical drying agent on it like cornstarch. And often we can do this preventively too. Topical antibiotic ointments can be of some use. We want to make sure that we don't leave that ointment on there to create more of a wet environment though. Surgical removal of excess skin is the only real cure for the problem. So some plastic surgery may be the key. We want to encourage weight reduction for obese animals through diet and exercise programs. Here's some information for the client. It does require long-term medical treatment. We want to keep those affected areas dry and clean. Weight reduction, mandatory for those animals with tail fold and vulvar pyoderma. Here you can see an example of a vulvar pyoderma where the vulva is inset a little bit into the skin. Dogs with facial folds, if we can keep hair away from the eyes and monitor the appearance of the cornea for any signs of injury. All right, deep pyodermas. This picture is obvious that this animal has a problem. Here's the head of the animal. Here's the forelimb, the left forelimb of the animal. The animal's lying on its side, and we have a clipped forelimb and abdomen here. You can see the swelling of this limb and the exudate and the deep holes and ulcerations within the skin, and even the necrotic tissue. This is not hair. This is dead, blackened tissue. They present a greater challenge clinically than do superficial infections. They tend to become chronic infections, and they're often resistant to treatment. It has been speculated that these pyodermas may occur in animals with some degree of immunosuppression or allergy. A great many of these cases involve the microorganism Staphylococcus intermedius, which was previously known as Staph aureus. It produces toxins and enzymes that cause severe tissue damage. Now, this is a bacteria that can live on our skin, but when it gets deep to our skin, it creates a major problem. We can see this, this is included, deep pyodermas include juvenile pyoderma or puppy strangles. Puppy strangles, if you remember what equine strangles is, and the lymph nodes, the submandibular lymph nodes getting very, very large and strangling, effectively strangling the animal. Puppies can get this as well. Interdigital pyoderma or interdigital cysts, generalized pyoderma, sometimes known as German Shepherd pyoderma, if you can guess what breed it usually will affect. Clinical signs and treatments of all deep pyodermas are similar. Clinical signs, we'll see papules and pustules with crusting in characteristic locations, and that's diagnostic. Dogs are often febrile. You may have draining fistula tracts with severe infection. Fistulas are openings between the interior of the body and the outside of the body. It's where infection finds a way out to drain, okay, and that's called a fistula. So we can look at the clinical signs. You can see a lot of these deep pyodermas include very thickened skin or swollen edematous skin. Culture and sensitivity will help us to diagnose it. We may need to get a biopsy of the skin as well. Treatment: thorough and gentle daily cleaning of the infected areas, topical water-based antibiotic creams, sprays, or solutions applied 2 to 4 times a day. It's a deep commitment for the client. Systemic antibiotics chosen from the culture and sensitivity results ideally, or a really good gram-positive spectrum drug. The therapy may be needed for 3 months or longer in many cases. Some typical antibiotics: Clavamox, enrofloxacin, cephalexin. You've heard of all 3 of those before. We can give a staphylococcal bacterin, that's like a vaccine, and we can give that weekly. And what that does is helps the immune system to fight Staphylococcus. It's called staphage lysate, and it is an injection that we would give in the hospital, typically weekly. Tell the client that the organism that is responsible for deep pyodermas is often drug resistant. We talk a lot about methicillin resistant Staphylococcus, and there are a lot of times when we do have that as well. Sometimes the treatment may be prolonged and expensive, especially in large breed dogs. These are big dogs, they need a lot of medication. There are underlying conditions that can predispose the animal to these infections, and we need to investigate for those. Diabetes mellitus is one, and Cushing's disease is another. Those are 2 endocrine diseases that can cause problems with other parts of the body, including recurrent skin infections. Some animals will actually never recover. Anal glands. We're here to anal glands. Anal sacs create a special set of problems in companion animals, and there are 3 commonly seen anal sac problems that you are going to be made aware of if you aren't already. One is impaction. Impaction is when the material within the anal sac gets very thick, very dry, and cannot exit through that very tiny duct opening. Chronic infection: if we get an infection in the anal sac, it can be very difficult to get rid of the infection. It is a environment that is separated from the body, and so it's very difficult to get medication directly into those anal sacs. Rupture or abscessation: so if we get an infection going on in the anal sac, that anal sac is basically an abscess waiting to happen. And so that will actually abscess to the point where, because it can't come out that little duct, it actually will burst or rupture through the skin. We see these anal sacs just below the skin at 4 and 7 o'clock or 4 and 8 o'clock positions, kind of depends on the dog. Each sac connects to the surface through a narrow duct, and the sacs are lined with abundant sebaceous and apocrine glands that produce an oily brown fluid that has a characteristic odor, and I'm sure you've all smelled that odor. Typically, when feces pass over the sacs are compressed and expel some of the fluid onto the surface of the fecal material. The odor of this fluid may have the function of social marking among dogs and cats. If the fluid produced becomes too thick or blockage of the duct occurs, the sacs will overfill, because the sac keeps on filling whether it can relieve the material or not. If water is reabsorbed from the fluid, the material dries out and causes impaction of the sac. Infections and impactions may result in anal sac rupture or abscessation. We commonly see this more in small breed versus large breed dogs, but we can see it in any breed dog. So how do we diagnose it? So if they have a history of scooting the rear end across the floor or licking excessively at the perianal area, that indicates that we may have a problem with the anal glands. If there's a foul odor, that indicates we may have a problem with the anal glands. If we do a digital palpation of distended anal sacs, we can do it rectally or we can do it externally, just placing our fingers below where the anal sacs are and pressing in and up. Make sure you're not standing behind the dog at that point because you can actually feel those anal sacs and express them. We need to express those contents. And sometimes that means the dog needs to be sedated because it can be very painful. It's like a pimple that just won't pop. If we are able to express those contents through the duct, we want to lavage that infected sac with saline or lactated Ringer solution. And we can actually take some otic solution, something I've used Malotic or Otamax that has a long tip, a long thin tip, an ear solution with a long tip that's used for application of medication deep into the ear. Most of those will actually go directly into the anal sac duct, and we can infuse that antibiotic ointment directly into the sac. If we have abscess sacs, we need to aggressively lavage and clean it. Sometimes we need oral antibiotics. If we have sacs that chronically are getting infected or have a really bad abscess, we need to surgically remove that sac. We always want to remember to clean the opposite sac, even if you're just treating one of the sacs for infection. Now, you may be asking, why don't we just remove all anal glands if they cause a problem? Well, there are a lot of problems with surgically removing the anal glands because there are a lot of nerves in that area, and if we damage those nerves in the area, we can actually make that animal fecally incontinent, and clients don't like that. Owners need to be shown how to check their pet's anal sacs, and if they request it, you can demonstrate how to empty them. Make sure they request it first, though, because it is pretty foul smelling and it's not very comfortable for the animal, so they need to be committed to doing it themselves. Scooting on the floor does not usually mean the pet has worms. Usually it means they have an anal gland issue. Blood under the tail may indicate a ruptured anal sac. These impactions and infections do tend to recur. Cats can also develop impactions, which can abscess as well. We don't see it as often in cats, but it can occur. Tumors of the skin. The word tumor can be defined as a new growth of tissue characterized by progressive, uncontrolled proliferation of cells. Tumors can be benign, do no harm, or malignant, may result in death. They can be localized or they can be invasive. Malignant tumors usually consist of poorly differentiated cells, meaning you can't really tell them apart from other cells. They can metastasize to other parts of the body and are usually invasive to surrounding tissues. Malignant tumors of the skin are usually carcinomas, those of epithelial origin, or sarcomas, those of connective tissue origin. So you think of the skin and you can think of there are epithelial cells in there and there's connective tissue in there. The ones that are made of epithelial cells, the malignant tumors of epithelial cells, are called carcinomas. Those tumors that are made of connective tissue are sarcomas. An estimated 37% of canine tumors and 24% of feline tumors involve the skin. Although there are no clear-cut cause of tumors that have been found, certain trends are worth mentioning. Most skin tumors occur in older dogs, dogs that are greater than 6 years, and cats that greater than 4 years. Younger dogs are more likely to acquire viral-induced tumors, and certain breeds, such as boxers and cocker spaniels, appear to be more susceptible to tumor development. There are some benign skin tumors. There are skin tumors that we don't have to worry too much about. The first one we'll talk about are histiocytomas. They're most often found in young dogs. They're almost exclusively found in young dogs. So if you see a tumor on a young dog, most of the time it's going to be histiocytoma. They're small button-like nodules, and they're usually pink. They're usually hairless and maybe ulcerated. They're found on the face, legs, lips, and abdomen, and they're a rapidly growing lesion. So if the owner says, oh, I just found this last night and it looks about the size of this lesion here, it's actually pretty possible that happened. So we diagnosed it based on its general appearance. We do need to biopsy it or do a fine needle aspirate of it. We can do a surgical excision of it. Within 3 months, usually these tumors will go away. It is a histiocytoma, so it is producing histamine. So it may cause the pet to be uncomfortable, pruritic. They may itch it, lick it, make it look a lot worse. So sometimes it's best to remove it, but usually within 3 months it will go away. So they're not malignant. They do not metastasize. It's not seen in cats. They do regress spontaneously. If we can remove it surgically and the owner doesn't mind, we can just take it right off and it won't come back. Lipoma. Most of you have seen lipomas, know what we're talking about. This is a tumor of fat origin. It's most commonly found in obese older dogs or dogs that had been obese at an earlier time in life. Female dogs are more commonly affected by male dogs. We see round or oval subcuticular masses. Usually they're just under their skin. Sometimes they are found within the muscle tissue as well. They tend to be encapsulated, so they are kept within a capsule, and they're slow growing. Lesions are soft and they're often freely movable unless they're contained within the muscle. 99% of these will be benign, although it is really good idea to get a biopsy of this. If we can clarify this as a benign lesion, it does provide a little bit of a sense of relief for the owner. A fine needle aspiration will provide a presumptive diagnosis. We'll see a gray, greasy, mucoid-like substance on the slide, and it's usually removed with the first step of staining. So we'll see nothing, no cells on the slide. Surgical excision is treatment of choice. We have to be very careful to close the tissue space underneath that mass because otherwise the body likes to fill spaces, and so it will create a seroma or serous containing mass, which will eventually go down in size, but it's a good idea to close that. Lipomas don't usually cause a problem until they get big. And when they get big and they interfere with the way the animal is moving, then they become uncomfortable or painful. They're rarely malignant. They can recur after removal or happen in other places. If you change a diet, if you have an obese animal and you put them on a diet, it's not going to affect existing lipomas. Even though they're benign tumors, they can grow very, very large. I have seen tumors like this turning from benign tumors into malignant tumors. So I typically recommend that we don't let them get this large and that we can remove it before they get that big. Papillomas or warts. These are most commonly found in young dogs. And remember what I said about young dogs getting neoplasia? Typically they're viral in nature. They begin as a smooth, white, elevated lesion. Sometimes it's an oral mucosa, and then it'll grow into a cauliflower-like growth. You can see few or multiple. It looks pretty nasty when you see it. Regression of the lesion may occur spontaneously. We diagnose this based on appearances. It looks like a wart. We can biopsy it. Treatment is surgical excision if you have a large mass, but if you get a large mass, sometimes the body will suddenly see that as a problem and will actually cause regression of the others. You can make an autogenous vaccine by grinding the tumor into a phenol, 5.5% phenol. Then you can inject it intradermally for 3 weeks, weekly for 3 weeks, and then the lesion will regress. Sometimes those lesions will regress without treatment anyway. The papillomas are caused by a DNA virus. It's typically a sexually transmitted virus, but it can be transmitted by contact. It will not last as long as 21 weeks or more. Cats are not effective. Older dogs are typically resistant because they've effectively been vaccinated or received an active immunity to it. It will regress spontaneously. and adult animals become immune for life. Sebaceous cysts can occur in dogs of any age, and they're more common in Cocker Spaniels. Cysts are encapsulated, round, and fluctuate with palpation, and when you compress them, they'll often exude a gray cheese-like material. They will slowly enlarge and may spontaneously rupture. They can be found anywhere on the backs, legs, chest, and neck of the animal. We diagnose by looking at it, feeling it, and seeing the exudate that comes out of it. We can do a histology of the cyst wall to make sure it's benign. We can, if we're going to surgically remove it, we need to get the entire encapsulated cyst, so every part of that gland as well. These growths are formed by degenerative changes in the glandular area surrounding the hair follicle. They're usually benign growth. We can remove it. Once we remove it, it cures the problem. They're typically slow growing. Dogs usually have multiple lesions at varying times, especially in breeds that are predisposed to this problem. I do have a standard poodle, and dogs with hair tend to be more predisposed to them. There are shampoos that we can actually use that remove the sebum and will actually reduce these cysts as well. So we can talk about that more in class. Malignant skin tumors, ones that we need to watch out for. The first one we're going to talk about are basal cell carcinomas. Clinical signs of basal cell carcinoma is that you see it commonly in adult animals. We'll see a single discrete lesion that is round, firm, and sometimes ulcerated. And this is a lesion called a nodule. The lesion is most commonly found on the head, around the eyes, ears, lips, neck, and legs. These lesions are slow growing. We would biopsy it or we can do a fine needle aspirate to get diagnosis. When we remove it, we need to do, because it's malignant and has a tendency to spread, we need to do a wide surgical excision, so at least 1 centimeter to 2 centimeters around each side. These tumors rarely metastasize, meaning they're not going to spread to through the bloodstream to other areas of the body. But once we take it off, we could get local recurrence. A less favorable prognosis exists if there are multiple lesions. So if we have one, we get it off with wide margins, and we get our biopsy back, and they say that there are there's no neoplastic tissue on the margins, then that we could get local recurrence, but probably we have a good chance of it being a cure. Fibrosarcomas that are not vaccine induced, we can see in older dogs. We see at the face, legs, and mammary glands at the most common sites. Tumors range in size, and they feel firm but rubbery on palpation, and that's because these are sarcomas, which means they're from connective tissue origin. So they're it's the same tissue that you find in joint capsules or protecting joints, or in tendons or ligaments. So it should feel like that. They typically are not encapsulated, meaning they don't have a capsule surrounding them, meaning that they can go to and adhere themselves to underlying tissues, and they send finger-like projections everywhere. We can do a biopsy to see what it is. You need a very wide surgical excision, and recurrence is very common because, like I said, it extends into the local tissue. Prognosis for fibrosarcomas is poor because the tumors are very invasive and they metastasize to other parts of the body very readily. Recurrence is common. We can use other therapies like radiation and chemotherapy, but they're not usually very effective. Sometimes when we say wide surgical excision, that means amputation of the entire limb. Feline fibrosarcomas, these are vaccine-induced, or in general, injection-induced. Until the late 1980s, we never saw this. We never saw feline fibrosarcomas. They were unrecognized. During that time, a killed rabies vaccine and the feline leukemia vaccine became available to practitioners. And then the incidence of vaccine-related tumors began to increase to between 1 in 1,000 to 1 in 10,000 vaccinated cats. With an estimated 20 million vaccines administered to pet cats throughout the world, this tumor development has become a significant problem for feline practitioners and owners. These tumors are rapidly developing, highly invasive, and malignant. They occur at the site of vaccination, usually within 4 to 6 weeks after the vaccine has been given. After routine surgical removal, they often recur, and by the time many owners act, it is too late to provide successful treatment of the cat. So what did we do? We developed a vaccine-associated sarcoma task force, and what they've decided that is in order to reduce the incidence of feline fibrosarcomas, we use single-dose vaccines whenever possible, meaning that we don't use multivalent vaccines. We don't use vaccines that are like feline leukemia and rabies, feline leukemia and distemper. We're going to use feline distemper, feline rabies, feline leukemia. Intranasal vaccines should be chosen when available, and we never vaccinate anymore between the shoulder blades. When I first left veterinary school 20 years ago, they were just starting to move from vaccinating between the shoulder blades to vaccinating as low on the leg as possible. The rabies vaccine should be given as low on the right rear leg as possible, leukemia low on the left rear leg as possible, and distemper combinations on the right shoulder. Separating the vaccines like this allows us to see which one is causing the problem and allows us to see which one may be causing an allergic reaction as well. If there is a swelling, because we'll often get swelling around vaccine injections, but if the swelling is not resolved within 6 weeks, we should go to surgery. We need to do a radical surgical excision. So we'll see swelling over the site of a recent vaccination in a cat. It will be a rapidly growing, firm, often elongated mass because it just wants to spread. We can diagnose it with a biopsy needle or a needle aspiration if we suspect it. In order to treat it, often we need a radical surgical excision, which may involve limb amputation. Once we get it removed, we have if we get it early, we have a good prognosis. Otherwise, we have a very poor prognosis. Some individual cats or breeds of cats may be genetically at risk for this disease. Inflammatory lumps do develop, like I said, over vaccine sites in many cats, but they should disappear within 1 to 2 weeks. If it doesn't resolve in 4 to 6 weeks, we need our clients to come in. Mast cell tumors. Mast cell tumors do not usually metastasize. However, up to 30% may metastasize. The prognosis depends on the amount of cell differentiation within the tumor. What does the cell look like? Can we tell it's a mast cell? If it's really clearly a mast cell, it's better differentiated. In dogs, the survival times range from 18 to 51 weeks. That's less than a year. In cats, the lesions are usually benign. So metastatic, malignant in dogs, benign in cats. Recurrence at the surgical site is possible, and there may be a virus that is causing some of these tumors. What will we see? We will see isolated firm nodules form in the skin. About 50% are found in the rear legs, perineum, or external genitalia. Tumors may be ulcerated and edematous. The tumors usually seen in dogs older than 6 years and cats older than 10 years. Siamese and male cats are usually predisposed, but remember in cats, it's usually benign. Lesions can appear crusty in cats, and when the crusts are removed, you'll see the ulcerated surfaces. The problem is that mast cells tumors can look like any other tumor. So any tumor that you see on an animal could be a mast cell tumor. They can look like lipomas. They can look like basal cell tumors. So this is why it's important to do a biopsy or fine needle aspirate. The problem when we do fine needle aspirate or a biopsy, anytime we do surgery to excise something that could be a mast cell tumor, we need to pre-medicate. Mast cells are cells that release histamine. Histamine is released with an allergic reaction. So if you're doing a biopsy or even a fine needle aspirate of this lesion, if you anger that mast cell tumor, it could release histamine, and that histamine could cause an anaphylactic reaction in the animal, which means we could lose the animal when we're just sticking a needle in it to find out what it is. So remember, anytime you do a fine needle aspirate or a biopsy and you don't know what this tumor is, you should do pre-medication with Benadryl. So we can do a biopsy. We can do impression smears on that biopsy. And if we see mast cells or mast cell granules, that gives us a presumptive diagnosis. Surgical excision with a lymph node, the closest lymph node, will help to rule out metastasis. We can use chemotherapy using vinblastine and Cytoxan. We can use radiation and cryosurgery. We've seen cimetidine, which is also known as Tagamet. It is a antihistamine used for gastric ulceration or gastritis. So if we have lymph node involvement or gastric ulceration, using cimetidine can be helpful in the treatment of mast cell tumors. A melanoma, either benign or malignant. Benign lesions are usually small, slow-growing, and hairless growths with dark pigmentation. Malignant growths are usually large, dome-shaped, sessile growths, which means they are on a stalk, and they have various pigmentations. Tumors most commonly occur in highly pigmented skins of the canine, on the oral and the skin and digits. Biopsy and surgical resection are indicated whenever we see a melanoma. We want to tell the client that tumors of the oral cavity and digits tend to be malignant, so we need to get them off. Because there's early metastases, the prognosis is often poor and recurrence after surgery is common. In dogs with small lesions, the median survival time is 12 months. 54% of these dogs are dead within 2 years. If they're larger lesions, survival time is 4 months. 100% of these animals are dead within 2 years. So we want to get these off very, very quickly. Perianal tumors, adenomas, or adenocarcinomas. Remember, what does carcinoma mean? It is a tumor of epithelial origin. Adenomas are most commonly seen in male dogs older than 8 years. That's male dogs, male intact dogs older than 8 years. Carcinomas occur with equal frequency in male and female dogs. Lesions are small, slow-growing, single or multiple lumps close to the anus, hence the perianal tumor. Lesions are frequently ulcerated, so the owners will see blood under the tail. Cocker spaniels, beagles, Samoyeds, and German shepherds tend to be predisposed to perianal tumors. Clinical appearance and location gives us our diagnosis. We can do a biopsy. A complete surgical excision is recommended. We do have to be very careful in this area. We don't want to disturb any nerves that are innervating that anus. We don't want fecal incontinence. Clients aren't very happy if their animals are fecally incontinent. Castration aids in prevention of recurring adenomas, so always a good reason to castrate. Radiation, cryosurgery are both effective in treating these tumors. Squamous cell carcinoma. This is a carcinoma, so again, it is the tumor of squamous epithelial cells. We find these in older dogs and cats, animals greater than 9 years of age. Lesions seen on the head, ears, oral cavity, nose, neck of cats, and the trunks, toes, and scrotum of dogs. And usually these are in non-pigmented areas. So unlike melanomas, which are in pigmented areas, squamous cell carcinomas are in non-pigmented areas. The tumor is going to appear raised and ulcerated with cauliflower-like mass with a necrotic odor. Unaffected animals have a history of being sunbathers. Diagnosis and treatment. We're going to do a biopsy, surgical excision, cryosurgery, and radiotherapy or photodynamic therapy can help to take care of these lesions. Tumors most often occur in sun-damaged skin. They're locally invasive, but they tend to be slow to metastasize. So as soon as you see them, you want to get them off. Recurrence after surgery is common. Preventing chronic sun exposure to the sun, or chronic exposure to the sun, will prevent the development of tumors. The degree of malignancy determines the prognosis, especially in cats with poorly differentiated tumors. They have a poor prognosis. So this is a common lesion in the mouth of a cat with squamous cell carcinoma. And then we have a squamous cell carcinoma in the non-pigmented ear of a white cat. Obviously, this gets a lot of sun exposure. I suspect we've been lying in the window in this direction for most of its life. Horses, another species. Let's talk about horse skin. Reporting of skin diseases in horses is quite common. It's not unusual for the owner to notice various lesions as the horse is being groomed and prepared for work. Following, I'm going to give you some questions in the history of a horse that's presented for skin problems. We want to know how old the horse is, what season of the year it is, which you should know when you're asking the question. Is the horse in stable or on pasture? What is it exposed to? Is the horse maintained in a herd or is it single? And are other horses showing signs of skin disease? Is it contagious? And where is the horse located? What geographical region? Answers to these questions can help narrow down the list of potential diseases affecting the animal. Insect hypersensitivity. This is awful for a horse to have. They get intensely pruritic. They'll have alopecia or losing of hair, excoriation. They're scratching away the top surface of the skin, erythema or redness, scaling. They may get hives, which you can see here, urticaria. Lesions are often along the mane and ventral body where they can't switch away the flies, but it can be anywhere on the body, especially if they're particularly allergic. So basically, if we have insects biting insects in the environment and the horse is allergic to them, they will have these signs. It's systemic. It's an allergic reaction to the bite of an insect. It's most often seen during the summer months, and it's first noticed in animals at 4 years of age or younger. The most common insects to cause the condition are those of the genus Culicoides. They're also known as biting gnats. So they're tiny little flies that bite these guys, and we need to protect these animals against this fly. So we use insect control and fly sprays. We can use steroid therapy to eliminate or prevent the allergic reaction. Antihistamines don't appear to be as effective, although I will tell you that there's a product called Histol. It's a powder that you can put in their food that does appear to be effective if given preventively. If the lesions have gotten severe enough, the animal will need antibiotic therapy as well if they have a secondary skin infection. The occurrence and severity of insect hypersensitivity may be prevented with good management. So if we do insect control with fly sprays, fans to keep the gnats off the horses, remember they're tiny little flies so they can be blown away with fans, keep the animals free of manure, or their area free of manure, and we can reduce the number of gnats. Fly bite dermatitis or fly strike. We can see this on small animals that are kept outside as well as large animals. They're the result of a bite of a fly, and we see these during the warmer months of the year. The clinical signs you're going to see are wheals, remember the raised red lesions, pustules, and nodules. We can treat with the application of fly sprays. We want to keep the manure leveled down. We want to use appropriate care of any wounds that may appear. Lice or pediculosis. Lice are one of the most common ectoparasites that affect horses. They're host-specific, remember species-specific, and there are two different species that affect horses. There's the sucking lice, Hemospinus acini, and they are the more damaging to the animal, and because they live off the blood. The biting or chewing lice, or Damalinia equine, live off the dead cells and other debris in the horse's skin. Lice infestation is usually seen in the winter months, so not during the summer, but in the winter. And the reason is that the horse's hair is longer and grooming may not be as thorough. So the horses may congregate together for warmth, so they're spreading the lice among each other. Transmission is through direct horse-to-horse contact, but it could also be carried on inanimate objects. What do we use as inanimate objects between horses? We use brushes for grooming. So it will cause intense pruritus, usually around the mane and tail. So we may see lesions around the mane and tail where they've been scratching. We can see adults or eggs in the hair. We can see the adults and eggs in the hair coat. We can treat with topical shampoos. We can treat the environment with a lice dust. We can clip the horses. We need to treat all the horses in the premises. We need to clean all of the grooming material. We can use ivermectin. It has more effect against the sucking lice than the biting lice because we can use it orally or topically. Mites. There are many different species of mites that are normal inhabitants of the horse's skin. Some are free living in the environment. The disease caused by mites is most often seen when an animal becomes immunocompromised. It causes intense itching. The distribution of lesions depends on the species of mite. We can do microscopic examination of skin scrapings. The treatment are things that will kill the mite: lime sulfur dips, pyrethrin dips, and ivermectin. Onchocerciasis is caused by a nematode parasite. This is a roundworm. The adults live in the ligamentum nuchae, which if you think of a horse and you think of their mane, there is a ligament that runs right underneath their mane. That is called a ligamentum nuchae, and it holds the top of their head to their scapula, basically, or their spine. And that's where the adult lives. But the larvae migrate through the skin and cause dermatitis. They also, you can see it in this picture of the eye, that is an onchocerciasis larvae. They are these small, they are carried by small insects, and they're non-seasonal in occurrence. This is a lesion right around the eye that is caused by onchocerciasis. It almost looks like this larvae just completely blew out of the skin. And this is what the larvae looks like. And you see these little tiny legs all over it. You'll see pruritic lesions, especially in the area of the ventral abdomen, bullseye lesions, especially on the face. Uveitis, inflammation of the eye, is often seen concurrently. We diagnose it through biopsy or histopathology. More common method of diagnosis is just observing the response to treatment. So we're going to treat it. We can administer oral ivermectin, repeat in 3 weeks. Death of microfilaria can cause intense itching, so we may have to get them steroids as well. But this could look like hives, but if these are firm nodules that cause intense itching, these may also be onchocerciasis. Rain rot, rain scald. This is one of the more common skin diseases of horses. When the disease occurs on the palmar and plantar aspects of the pasterns, it can be referred to as dew poisoning or mud scratches. So basically think of it as the skin gets very, very moist, and then the skin becomes macerated and damaged. And so fungal and bacterial components can come into the skin, and it can cause this rain rot, rain scald, dew poisoning, mud scratches. Those are the common names for the disease. The bacteria that causes this is Dermatophylosis congolensis, and it's also referred to as dermatophylosis. Condition is usually seen during moist conditions, and in a larger portion of the United States is most common in the winter months. Causative organisms can become trapped in the hair and reproduce in a moist environment, and the condition can be passed by direct contact or transfer from inanimate objects like grooming brushes. What we will see is matting of the hair followed by alopecia. The hair will come off because it's easily epilated. It's got some fungal components to it, got damaged skin, and we'll see crusting. It'll look like paintbrush lesion. It looks like the hair epilates or is removed in clumps that look like it's been painted away with a paintbrush. You'll see the lesions most often along the back, unless it's mud scratches or dew, caused by dew, and that most often occurs on white legs for some reason. It's just more sensitive skin. It's often non-pruritic, but it could be very painful. Clinical signs and history are highly suggestive, and definitive diagnosis of the condition is made by observing an impression smear of the lesions. Treatment usually consists of bathing with one of the following iodine-based shampoos, chlorhexidine washes, dilute bleach powder, and antifungal powder. Rain rot can be prevented by daily grooming. So that's really important to do for your animal. If they do experience development of rain rot, you need to clean the brushes, blankets, and everything that has come in contact with an iodine-based solution before it's used on another horse. In many areas of the United States, this is a common problem with longer-haired horses, winter hair, that are outside in wet spring weather. So if we clip the coat or use a good shedding blade, we can allow the coat to dry faster, and we can avoid that. Sarcoids. Sarcoids are the most common skin tumor of horses. They are slow-growing and locally invasive, but not metastatic. The onset of the tumor is mainly seen in younger horses, so these are less than 10 years of age. There's a possible viral cause leading to the tumors. Sarcoids can be single tumors or multiple nodules. We need to do a biopsy of this tumor to diagnose it. Treatment is most often treated by surgical excision, injection of a chemotherapeutic agent directly into the tumor, or cryotherapy. If sarcoids get very large, they can actually cause some major ulcerations and problems with the skin, and sometimes the horse needs to be put down. Proud flesh. We've talked about proud flesh before when we talked about wounds. And remember, this is granulation tissue that's become a little bit exuberant. Treatment for proud flesh, we can use a meat tenderizer, which sounds funny, but meat tenderizer, basically what it does is it destroys tissue. We can use enzyme sprays. We can cut it off, but remember, it bleeds really, really well. We want to avoid caustic substances that delay healing, like furosin ointment, because sometimes that will increase the development of proud flesh. When the proud flesh is cut off, it will bleed profusely, but the horse will show few signs of being aware of the procedure. So it's a lot of blood, but not a lot of nervous tissue there. So it's rich in blood vessels, but more scar tissue than nerve endings, so they don't feel it. Proud flesh is that red protruding flesh that can be found on the distal limbs after an injury. It's scar tissue that's growing out of control, or exuberant granulation tissue. It's red, it's got a cauliflower-like growth over a wound, and it bleeds easily. We can prevent it by wrapping the leg, the limb, or the wound, keeping pressure on it. We can use chlorhexidine or diacetate, Novosan steroid ointment, or some enzyme sprays. Sometimes scarlet oil will work, even though it is a little bit caustic. If you do have proud flesh, we may have to do it. But this is an example of how much blood you can get from a small area of proud flesh. Wounds to the skin can be from any external source of trauma, and the specific treatment for the wound may depend on the source. In general, we're going to treat the wounds by stopping the blood loss, clipping the hair from the area, and cleansing it thoroughly. And then we need to evaluate whether we want to do sutures or staples. Puncture wounds need to be flushed thoroughly and allowed to heal from the inside outward. If we allow it to heal on the top first or on the outside first, anything that might be contained within that wound, like bacteria, could cause an abscess within there if it's closed off from the outside. Any puncture wound in close proximity to a joint needs careful evaluation by a veterinarian to determine whether the joint capsule has been compromised. Most wounds will benefit from antibiotic therapy, and whenever a horse has a wound, we need to get a tetanus prophylaxis to prevent them from getting tetanus. So if an injured horse is current on tetanus vaccination, we can give them a tetanus toxoid booster. We don't want to use a tetanus antitoxin in vaccinated horses because severe anaphylactic reactions have been reported. Sheep and goats, their skin problems are not uncommon in sheep and goats, and conditions can lead to a loss of production through decreased growth, damaged fiber, and weight loss. We want to get a good history, clinical signs, and a good physical examination to determine the cause of the skin problem. A couple of common things that we see in sheep and goats would be contagious eczema. It's caused by a parapox and it shows a preference for attacking epithelial tissues. It's a virus that's present throughout the world, and it remains active in the environment for months, if not years. Transmission is through direct contact or contamination of skin abrasions, and morbidity, which means how quickly and how much it moves from animal to animal. It's greatest in animals that are grazing coarse pasture plants. So the pox virus gets into the skin because of small lacerations or abrasions. Contagious eczema. So this is a contagious eczema as well, or sore mouth or orth. We see papules, vesicles, and pustules. Remember, this is a pox virus, so it can cause zoonosis in the human. We see thick crusts, especially around the mouth. Lesions may spread to the oral cavity, eyelids, feet, udder. Lesions typically resolve in 2 weeks. We can examine a skin biopsy to diagnose it. Treatment of the individual animals is generally not necessarily needed unless the lesions are severe, and then we need to do supportive care so they can eat. It is zoonotic, so we need to wear gloves and maintain good hygiene when handling infected animals. With this picture on here, because you can see this person is not wearing gloves. Fortunately, he's not touching these lesions, but maybe he's this person too. That's all we have for today. We were going to talk about this more in class, so if you have any questions, please write them down and we'll share them in class.